Thanks for having me. Welcome. As you guys all are aware, we're talking about functional mobility in geriatric dogs today. And just my typical disclosures, some companies that I do consulting for, as well as the companies that fund the research that I do. So our general agenda today is going to be talking about healthy aging, what defines healthy aging, so that then we can kind of look at what those effects are that affect that aging process. And so how does decline in physical function happen? What is the importance of exercise? How do we integrate rehabilitation modalities for managing mobility? And then how do we kind of generally approach planning for improving mobility? So optimizing functional mobility should be a whole body approach. There's not just one thing that you should be doing to optimize functional mobility. It needs to take into account pain management, exercise, nutrition, treatment of comorbidities, which is especially relevant for these geriatric patients who likely have combinations of osteoarthritis, maybe some metabolic diseases, and then the kind of behavior, cognitive, and enrichment piece, which is also really critical in these geriatric patients. And then we also need to consider not just the dog, but also all of the factors that affect function, movement, and aging from the owner's perspective. So what is their environment like? Do they have to navigate multiple sets of stairs a day? Do they have slippery wood floors? What are the limitations of the owner themselves? Do, they have mobility limitations themselves? Are they 70 years old and have a hard time doing the stairs and therefore can't help their dog do the stairs? What's that burden on the owner look like, and how does that affect the human-animal bond? And so really the trifecta for kind of aging and mobility issues is a sedentary lifestyle, obesity, and sarcopenia, which is basically old age muscle loss. All of these are highly interrelated. It becomes a vicious cycle. So if they're sedentary, they're more likely to be obese, and they're not exercising as much, and they're going to lose muscle mass. When they lose muscle mass, they don't move as easily, so they become more sedentary. And so this is all kind of interrelated. But all of these three things are treatable, and the primary treatment options are diet and then exercise and rehabilitation. And so that's what we're going to kind of talk about. But first, we're going to talk about, what defines aging and what factors kind of affect aging. So aging is a complex process, and the health effects of aging typically involve increased risk of disability, disease, and death. And it's got multifaceted impacts on health and well-being. They're typically aging processes at the molecular, cellular, and tissue levels that lead to kind of a loss of robustness or the ability to kind of maintain an optimal state of physiologic functioning. And then that manifests as dysfunction and disease. And it presents a significant emotional and financial burden, particularly on the owners of these dogs. And once again, increased risk of disability, disease, and death. So what about, like, how do we capture and evaluate kind of aging? And so there's this idea between like looking at lifespan versus health span. And in the past, it's been kind of typically lifespan that we've been looking at. So the lifespan of the dog, the lifespan of the human, because it's an easy thing to measure. When you die, that's the end of your lifespan. But it really doesn't fully capture what is involved in aging, those processes that happen at the end that really affect kind of how the patient functions, how their quality of life. And so that's kind of developed this new kind of idea of evaluating health span. And so health span is the period of time before the occurrence of age-associated disease or disability. So it's essentially the time before that quality of life is affected by aging. And what that does is it shifts the focus of evaluation to that kind of non-fatal burden. And so this is that period of time that we can have an impact on. Ideally, in theory, we can have an impact on lifespan. We can extend lifespan. But what we really want to do is improve that lifespan and improve the health span. We want to really maximize the time of good health for our patients and limit the time in functional decline. Because if we delay death without improving that health span, what we're doing is extending the time that the dogs spend or cats spend with a poor quality of life. And as practitioners, none of us want that. We want to have these geriatric patients living a good quality of life right up until the end. And so there's this kind of theory about this, what they call this canine geriatric syndrome. So this has kind of been developed based on kind of these human conceptual frameworks. And the idea was that they were going to develop this framework for understanding canine aging. And it basically evaluates all of these different kind of subcategories that can have an impact on aging and lifespan and health span. So things like physical changes, functional changes, behavioral changes, metabolic changes, frailty, which is a really big kind of thing that they're evaluating in humans, and it's starting to be looked at a little bit in dogs. And then the quality of life and caregiver burden, clinical disease. So all of these things kind of play into aging and are all interrelated. So how does that involved with kind of the functional mobility? Because that's kind of what we're talking about. We're not talking necessarily about all of the old dog, diseases that happen. We're really talking about functional mobility. So that decreased mobility. So that's a functional change, is that decreased mobility. So what other components of that canine geriatric syndrome play a role in decreased mobility? Their physical changes. So once again, obesity, so increased body condition score, and sarcopenia, that muscle loss, are physical changes that affect that mobility. Behavioral changes can affect mobility as well. So cognitive dysfunction, behavior issues related to chronic pain. There's a lot more research going on about how chronic pain affects behavior, even in dogs. A lot more research on the human side. But that kind of behavior, the kind of isolation, the potential increase in anxiety, or aggressive type behaviors can affect mobility and that human-animal bond. And then there's metabolic changes that can affect mobility because they can play into things like muscle weakness, loss of muscle mass, and then clinical disease. And this is a really big piece from functional mobility in our geriatric patients. We know that osteoarthritis is one of the most common conditions that geriatric dogs and cats will have. The studies aren't great on actual numbers, but at least 1 in 4 dogs will develop osteoarthritis. And I think likely it's much higher than that. And in cats, there's a huge proportion of cats that have osteoarthritis and aren't even diagnosed, that because cats are really good at hiding their signs with OA. But we know osteoarthritis is a big component of chronic pain, mobility issues, and just quality of life in general for our geriatric patients, both dogs and cats. And then neurologic disease is another big component of decreased mobility. So neurologic diseases like intervertebral disc disease, degenerative myelopathy, different kind of polyneuropathies, GOLP in geriatric patients. So all of these things can affect these, mobility changes in geriatric patients. And then kind of is separate, but also intertwined in this kind of canine geriatric syndrome is quality of life. And it has it basically looks at the impact of aging across multiple domains. And so how does it affect physical health and function, cognition and mood? And then it's a little bit easier to evaluate in people is the kind of psychosocial aspects of life. And in our veterinary patients, that's things like how do they interact with the owners, the cats that are hiding under the bed all day because they have chronic pain and OA or metabolic diseases or any sort of issues that are affecting that psychosocial aspect of their life. And we know that quality of life assessments are one of the key factors in decision making about euthanasia for dogs, and that there's a strong relationship between perceived quality of life and mortality risk. Obviously, if people think that their dog has a poor quality of life, they're more likely to euthanize. And so there are these kind of health-related quality of life instruments that we can use to predict health outcomes. They're more common in people, but they are starting to be developed in canines as well. And the reason we're talking about this is it's really important to be able to assess these different aspects of aging in order to be able to determine what your interventions are actually doing. And so I talk a lot about assessments because if we're just throwing interventions at patients and not assessing kind of a baseline quality of life or baseline functional mobility, then it's a lot more subjective trying to determine what those outcomes are from adding NSAIDs or adding rehab or adding modalities, because the owner may not really recognize the full scope of the impact on their patient because they see them every day. So I like using these kind of more objective tools as baseline and then check-ins to be able to say, like, are what we are doing, is it actually working? Or do we need to change our plan? So health-related quality of life tools, this slide I know is really hard to read, but there are tools that have been developed basically for a specific kind of target condition. So there's tools for looking at patients with cardiac disease, cancer, spinal cord injuries, diabetes. So all of these different things. And so basically picking your tool. And there's a lot of newer ones from that list. So this has become kind of more of a push to be able to evaluate quality of life and this health span in dogs. So there's new tools that are being developed all the time. And so there's some recent studies for these different kind of instruments that you can use. And so how does this apply to actual physical function? Because that's, once again, tying this back to functional mobility. Physical function is critical for quality of life and aging. When you have impaired physical function, you have diminished health and well-being, you have poor cognitive function, you have increased risk of disease and death. And aging typically results in loss of strength, decreased stamina and energy, and impaired mobility. So once again, kind of a vicious cycle. And in people, and then therefore in dogs, we know that effective assessment of age-associated physical dysfunction and development testing of interventions to preserve and restore it is one of the keys in mitigating the negative impacts of aging and extending health span in dogs. So if we can use these kind of tools and these assessments and your physical exams to catch this decline in physical function early, we can implement interventions earlier and potentially improve and extend the health span of our patients. So what all impacts this decline in physical function? So there are biologic factors that are just a part of aging. So this sarcopenia or loss of muscle strength is just part of biological aging. And that also comes with increased fatigue and decline in cardiopulmonary capacity. This just is part of, the aging process, but we can have an impact on these things. Also, chronic low-grade inflammation and age-associated diseases. So things like cardiovascular disease, musculoskeletal disease, so particularly osteoarthritis, and then neurodegenerative diseases can all affect this, physical function and cause decline in physical function. But we have interventions to target all of these things. And so can we catch that earlier and start implementing these interventions earlier? And then this has been well described on the human side, but not as well on the canine side, these kind of contextual factors. So we know that decline in physical function in people results in increased depression and other mental health problems. It, causes a lack of physical activity and then a lack of social support. And once again, this kind of vicious cycle. And in dogs, we have to take into account the owner's factors. So do they have time and motivation to walk their dogs and exercise them? Can they provide the care that they need to impact that kind of aging process? And I think we do see, depression and cognitive and behavioral, impacts of decline in physical function in dogs. And so how do we assess physical function? Do we have assessments that can predict the outcome and guide the interventions? Not really. This has been assessed, like hugely assessed in people. Obviously, aging and geriatric care in people is a entire field. There are specialists that are basically gerontologists, and we don't really have that in our, veterinary side. Like basically all GPs are gerontologists. We all see geriatric patients. And so, can we develop this kind of more niche area of practice to really help our geriatric patients? And so this is kind of from the human side. How do we assess physical function? So there's a number of pieces of physical function. It's not just strength. It's not just muscle mass, but it's balance and flexibility and coordination, that cardiorespiratory fitness. You can have strength, but if you don't have cardiorespiratory fitness, that strength isn't going to matter. And then that whole piece of energy. And it's a really kind of complex integration. And in human medicine, they have tools to assess every single one of these pieces of physical function. And all of those tools have been validated to correlate with different outcomes and have these kind of rubrics for how to integrate interventions. And this is a big gap that we just don't have on the veterinary side. And in humans, they have this kind of basic activities of daily living. And so a lot of their assessment tools are, can the human actually perform the things that they need to be able to do to basically just have a daily life? So can they coordinate simple physical movements to be able to perform these basic activities? And so on our veterinary patients, that would look like rising from laying down, being able to go outside to go to the bathroom, accessing food and water. If dogs have impairments in these abilities, that increases the care burden for the owner and then interferes with that human-animal bond. So every time that dog has to get up, the human has to help them, or they have to, assist them outside to go to the bathroom, hold them up while they eat or drink, or provide food or water for them. And so this kind of basic activity for daily living needs to be our number one priority when trying to optimize this functional mobility. They have to be able to do these things. And then beyond that, we can make it a little bit more complex. So we obviously want them to be able to perform the basic tasks, but then there are these kind of activities for daily quality of life. And those are the things that are going to be more dog and human owner dependent. So if they have a full flight of stairs and the owner says, I really want them to be able to come up and sleep in the bedroom with me, I really need them to be able to do a full flight of stairs. Or they love going to the park and sitting outside of the park, and I really need to be able to get them in and out of a car to be able to do that. Interactions like playing with toys, being able to get on and off the couch, obviously having control of their urination and defecation. These are kind of more complex tasks. And so we build our rehabilitation plans and our exercise plans and our kind of functional mobility plans for meeting these basic activities first, because those are the most critical, and then building upon that to these kind of more complex activities that are really important for that dog or that human and that pair, and really, improves that human animal bond. And so how do we measure these things? Once again, there's a huge battery of tests on the human side that they do in elderly patients to evaluate basically what their kind of outcome is going to be. And so things like rising and walking, hand grip strength, and interestingly enough, like hand grip strength in people is really highly correlated with your lifespan. The stronger your hand grip strength, the longer you're going to live. We obviously don't do hand grip strength in dogs. That wouldn't be a thing. But all of these kind of things that they can do in people, can we develop similar types of measurements in dogs? So rising up and moving a certain distance, walking speed. In people, they have a 6-minute walk test and a timed up and go. And so we're going to talk a little bit about what tools we have to use in dogs and how we can use them to basically optimize kind of our planning for our patients. And so in dogs, there's a paper that basically tried to develop this kind of canine geriatric functional scoring system. So a number of kind of physical tests for the dog to do. Each test would get a score, and then that total score would kind of determine their full functional score. And that includes the tug test, which we'll talk a little bit more about. And then there's all of these other instruments that aren't specific for mobility, but have pieces of their evaluation as kind of mobility things. So the COAST staging tool, the Canine Orthopedic Index, the Liverpool Osteoarthritis Index, and then things like CVPI, that pain index, all of those have pieces that ask about kind of physical function and mobility, but aren't specific for mobility. But we still use them in all of our patients. We actually have all of our patients, all of our people fill out Helsinki pain indices for every time, like every patient that comes in. We also do a lot of CBPI. So once again, these are kind of our validated surveys for pain and quality of life, but do have a mobility piece to it. This is impossible to read. I understand that. This is from a paper by Chris Fry in Frontiers that was the canine functional scoring system. This was their proposed system. And so the idea was that they were going to develop this system and then test all of these pieces to see if they could actually validate it. And so using kind of these functional testing in combination with your exam findings is kind of how you're going to develop this plan. So muscle girth measurements, goniometry, so range of motion. Obviously, in kind of the more researchy side, we can do more gait analysis, weight bearing. There's development currently on more commercially available wearable sensors that are more accurate in evaluating functional mobility, and then evaluating kind of the strength, endurance, and then balance and proprioception. So in humans, one of those kind of pieces of this functional physical function is strength. And we know that decreased strength is correlated with frailty and sarcopenia, so that muscle loss. And there's a whole battery of tests for people. So that grip strength test, sit to stands, which is, we can do in dogs as well, but there aren't any that are validated in dogs. And so there are some that are kind of proposed. So how long can a dog hold a 3-legged stand? and then a down to stand, which is in that canine geriatric functional scoring. So this is what that canine muscle test looks like, which isn't validated, but can at least give you some idea of what that dog's strength is. And then this is how they grade it. So can you hold the limb for 30 seconds and then you do it on neutral ground and kind of incline it? And so a normal strength would be able to maintain that three-legged stand on an incline. And a 0 would be they can't do that at all, even on a neutral ground. And then this is that piece of that canine geriatric functional scoring, so down to stand. And so their proposed testing was how many times can you do a down to stand in a 60-second period. And so 0 to 4. So 4 was they could do more than 15 repetitions, and 0 was they couldn't even do a single one. The thing with these compared to what we have in people is this is a good baseline, but we don't have any idea how it actually correlates with outcomes. So, in people, they say, we know that that hand grip strength is a strong correlation with, lifespan and health span. In dogs, we don't know if, do dogs that fall into this 3 category, are they significantly more impacted than dogs that have this can do 15 reps? We don't really have that information yet. But hopefully we will at some point. And so what about in that kind of endurance mobility piece? In humans, they have a 6-minute walk test and a timed up and go. And then they also have rating of perceived exertion. And so can we do something similar in dogs? 6-minute walk test is actually reported in dogs to be used to evaluate cardiopulmonary function, not used as a functional assessment for aging or mobility, just trying to evaluate between dogs that are healthy and dogs with pulmonary disease. The cool thing is that now the timed up and go test is validated in dogs. So this is really brand new. So it was a piece of that canine geriatric functional scoring that they did at Cornell, and they've basically been validating this specific test. And so the first paper was just in August of last year, and then this newer paper literally just came out like last week. And so what it showed was the timed up and go is repeatable, and it correlates with basically activity as measured by accelerometers. So the better they are at this timed up and go, the more active they are at home, and it is repeatable kind of across tests. And so what does this test look like? And so this is something we actually do in our practice. So we use that canine geriatric functional scoring testing system as basically a baseline, and then to evaluate how what we're doing in our rehab plans is affecting it. So the timed up and go is rising from a down to a sternal position, getting up, and then moving 10 body lengths on a flat ground at the quickest manageable gait. And so can they do that? Basically, if they can do that in less than 5 seconds, can they move their 10 body lengths in less than 5 seconds? Then that's normal. And then they can't do that at all as a 0. And then, the ranges in the paper were kind of all over the place. And a lot of of the geriatric dogs even had times of up to 60 seconds or so. So very slow. They could move that 10 body lengths, but it was quite slow. But once again, we don't have any idea of how that correlates with actual long-term outcome. So they've done the validations and being able to correlate it with these other kind of objective outcomes like load and CVPI. And they found that it correlates that the shorter times to be able to go that 10 body lengths correlates with kind of more vigorous home activity. So in theory, better functional mobility. But we don't know if that truly is related to their health span or lifespan. But I suspect that it probably is, and we'll have that data, over the next number of years. And then there are, canine perceived exertion scales. They're not used very often, but they are validated in dogs. Balance and proprioception, once again, a number of ways of evaluating that in humans. We don't have any validated tests in dogs, but these are the two kind of proposed tests on the canine geriatric scoring system. So can they step over cavalettis, and can they do figure eights? And so we are, or not we, but the veterinary community and researchers are in the process of developing tests that can be implemented in practice. And the nice thing about these tests on the canine geriatric functional scoring system is they're fast to do. You can do the whole battery of tests in less than 15 minutes. And so we have separate appointments that are scheduled to basically kind of do this geriatric scoring and, pain assessments and this kind of workup for our geriatric patients. So kind of now switching from assessments to interventions. Everybody knows exercise is good for you. A sedentary lifestyle is one of the kind of key predictors of aging in people. And so increasing age and increasing body conditions are negatively correlated with activity levels. So once again, that trifecta that we talked about at the beginning being all interrelated. So sedentary lifestyle often happens as dogs get older. They get overweight, they have less activity, they get more overweight, and all of this impacts that functional mobility and their ability to do those instrumental activities of daily living, the basic activities of daily living, that has kind of a general impact on their overall well-being and quality of life. Just like people, dogs lose lean muscle mass and gain body fat as they age. Happens to everybody. It's just a part of that metabolic aging process. But we know on the human side, especially, there's been a massive amount of research on this, that exercise can combat this. And, in people, we know that heavy weightlifting, like doing strength training, is one of the best ways to kind of combat muscle loss in people, especially kind of women, like middle-aged women. And so can this also apply to dogs? And we don't really have any studies, but at least in people, it holds true. So I suspect that it probably also holds true in our canine patients. And so exercise is the most effective intervention to sustain physical function in humans. And I would bet that we could say the same thing about dogs. And then when we look at exercises specifically, how do we use exercises to improve specific elements of physical function? So things like strength, balance and proprioception, endurance, those pieces of physical function. And then also kind of on a more granular level, how do we then improve those activities of daily living? And so exercise and developing strength and conditioning planning could be whole lectures in and of themselves. But essentially, you need to have kind of multi-component exercise to improve overall function. And so in people, they've shown that you really need a combination of strength training and aerobic training, that has the most benefit for function and muscle mass. And so we can essentially use that in our veterinary patients. Can we do targeted strength training, so rehabilitation type exercises, and aerobic training? So whether that's walking, jogging, treadmill work, underwater treadmill, swimming, combinations of those exercises to have the biggest benefit on muscle mass and function. There was this study, it's a little bit older now, looking at integrating a physical training program in a weight loss plan for overweight pet dogs. So this was looking more at kind of body weight. And what they did is they had a fitness and diet group that did a training program that included underwater and land-based treadmill exercise just 3 times a week. And then they had a diet-only group that had no change in exercise routine. And they found that lean body mass was preserved in the fitness and diet group, and loss of that lean body mass was found during it for the diet only. So if you have an overweight patient and you just put them on a diet, they're going to lose lean body mass. So you're going to have a little bit more of an uphill battle to improve their strength and their mobility after that weight loss, as opposed to if you combine these two things. So it's really important to have a plan for both diet and exercise to be able to optimize the weight loss while maintaining that lean body mass and muscle mass. So what kind of exercises? We briefly talked about this, but aerobic exercises would be things like underwater treadmill if you have access to that, land-based treadmills, prescribed walking and jogging programs. And I have prescribed on there because I think it's important that we have some input into what the owners are doing, because if we just tell them, oh, take your dog running or take your dog walking, they might underdo it, they might overdo it. And so helping to develop kind of this incremental building of an exercise plan for your patients is really kind of an important piece. And it's an important piece in the owner buy-in. If you give them minimal instructions, they're less likely to do it than if you say, okay, we're going to have your overweight dog start with a 5-minute walk this week, and then we're going to add 2 minutes, and then we're going to add another 2 minutes. And so having this kind of prescribed program is a really important piece. Swimming is also a nice option for dogs that like water. And then strength exercises, these have to be targeted exercises. And in people, when you're doing strength and conditioning, there's a whole piece that's specificity. The exercises have to be specific for the activity. And so this is where knowing the kind of instrumental activities for daily living and those basic activities of daily living are important in developing the strength exercises. Because if the owners say, I have a flight of stairs and my dog really needs to be able to go up and down the flight of stairs, then you can look at the kind of movements that are required for navigating a set of stairs and developing your exercise plan to be able to develop the strength and coordination for navigating a flight of stairs. If they live in a ranch and the dog doesn't have to do any stairs, then those are not the exercises that you're going to be focusing on. Maybe their goal is just to be able to walk 4 blocks around the neighborhood. And so your exercise plan is going to be tailored for that patient, what their weaknesses are, what they need to be able to do. And then you also need a balanced approach. So making sure you have, forelimb exercises, pelvic limb exercises, and core exercises. And so once again, harping on this a little bit, but focus on improving those functional limitations to allow the dogs to be able to do those basic activities of daily living, and then those activities that are important for that particular dog-human pair. Nutrition, so exercise and nutrition go hand in hand and are probably the biggest interventions for managing functional mobility, managing aging. We know that exercise and nutrition are key pieces in slowing this aging process and improving health span and lifespan. So once again, we've talked a little bit about this already. Sarcopenia is the loss of lean muscle mass that's associated with aging. Typically, it's related to kind of mitochondrial dysfunction, hormonal changes, neuronal regulation, and lack of exercise all kind of play into this. And in people, sarcopenia has been shown to increase morbidity and mortality. And once again, nutrition and exercise are the interventions to help combat sarcopenia. So higher protein diets help to counteract the effects of sarcopenia. We know geriatric dogs have a higher protein turnover and require more protein to maintain muscle mass. And really the quality and quantity of protein should be optimized. So your daily protein for a geriatric patient should be greater than 3 grams per kilogram of lean mass. Now, obviously, this is a general rule. This would be different if your patient has renal disease. and protein loss or things like that. So this is not a blanket statement, but for your otherwise metabolically healthy geriatric patient, a higher protein level is important. And then there are also supplement interventions. So Myos is Fortitropin, and then a newer one, Ursolix by Verbac, is a ursolic acid. There have been a number of studies on how these products affect muscle mass. So the Fortitropin or the Myos has been shown to reduce muscle loss after surgery and improve mobility scores in geriatric patients. The Ursolix is newer, so there's only one study, but it showed that it decreases muscle atrophy, improves exercise participation, and functional performance exercises. So kind of their testing battery that they used on these patients. So kind of in addition to the sarcopenia piece, we also have to address the obesity piece. We know that obesity decreases lifespan. It increases morbidity. So weight gain exacerbates osteoarthritis. It also affects metabolic changes. And it just overall increases the forces on the body. So if you have a patient that looks like this, the dog has cruciate disease, but you can throw all the pain medications, NSAIDs, gabapentin, you can do all the modalities. And if they're that morbidly obese, all of your other interventions are probably going to have a minimal impact on this dog's overall well-being. The thing that's going to have the biggest impact on this particular patient is going to be weight loss. And this dog did end up actually losing about half of her body weight. And I don't think I have the after video of her running down the sidewalk, but weight loss. And it's the best studied and most consistently effective approach for slowing aging and extending health span and lifespan. And probably all of you are familiar with the study that was done a number of years ago where they took Labrador retrievers, 24 pairs of litter mates, and then free fed half of the dogs and then had a paired litter mate that got fed 25% less of what the other dogs consumed. And the calorie restricted dogs lived 15% longer. And they found that the calorie restricted dogs experience an onset of chronic disease significantly later. So a mean difference of like 2.1 years later. And so that's health span as well as lifespan. If they develop chronic disease later, their health span is improved. So I think this is one of the really key components of improving, functional mobility, improving quality of life, delaying kind of this aging process. And then kind of another piece. So diet and exercise really need to be the two main pillars when you're looking at managing your geriatric patients and their functional mobility. But then beyond that, we have a whole nother host of things that we can do to help with their quality of life and mobility. And so modalities are one piece, and they improve functional mobility through pain management, improve joint range of motion, and improve flexibility. So what we're looking to do is affect the actual restrictions that the patients have with joint range of motion or sore muscles or tight, areas, all of these compensatory patterns that they've developed, affect, joints that are, have osteoarthritis, which we know a lot of our geriatric patients are going to have. And so what modalities do we have to do this? Shockwave is probably the one that I recommend the most. And how I choose my modalities and my kind of plan is I take, the things that are going to have the biggest impact and have the most evidence behind them. So, diet and exercise are obviously key pillars, but then once we get into, this dog has elbow arthritis or chronic cruciate disease or, low back pain from LS disease. And we've kind of optimized their diet and we've improved their exercise, but their functional mobility is still limited by these other kind of comorbidities. Then we layer in these modalities and these other things, focusing on the ones that have the most research and are going to have the biggest impact on that mobility. So Shockwave is the one that I recommend the most. It's a focused high velocity sound wave, and it has kind of this short buildup time and then this exponential decay followed by a negative pressure. And shockwave differs from kind of ultrasound waves because the shockwave actually has kind of a lower frequency. It has minimal tissue absorption and a lack of thermal effect. There are 3 types of focused shockwave units: the electrohydraulic, the piezoelectric, and the electromagnetic. Radial shockwave, which you'll see in some studies, is not focused and isn't really a true shockwave. It's more of a pneumatic mechanical concussion. The challenging thing about having all of these different types of shockwaves is it makes it hard to take studies and protocols from one and apply it to another because the energy and the properties between the different types are different. So the protocols are not necessarily equivalent or comparable. So how does shockwave work? So essentially, as the sound travels through the tissue, it releases energy and has these biologic responses. So affects things like nitric oxide, vascular endothelial growth factor, improves like neovascularization, has effects on bone repair, tendon repair, tissue regeneration. So it has direct and indirect mechanical forces on bone and soft tissue and muscle. We know it protects chondrocytes, disintegrates calcifications, recruits stem cells, and we do know that it improves pain. The mechanism of action of that isn't quite understood yet, but we do know that it has effect on pain. These are some of the protocols that we use with the PulseVet. So for shoulder tendinopathy, hip osteoarthritis, elbow osteoarthritis, lumbosacral pain, and then kind of myopathies. Indications. So all of these kind of comorbidities and, issues that you can see in these geriatric patients. So cranial cruciate ligament injuries, obviously a big one in older patients, osteoarthritis, lumbosacral disease, even just muscle pain from compensating, we can use shockwave for. And then tendon and ligament injuries, which obviously could be a component in our geriatric functional mobility, but may only be a small component. There are actually a number of studies on using shockwave for osteoarthritis, which once again is going to be the clinical disease that you're probably treating the most in geriatric patients that are affecting that functional mobility piece. So we aren't going to get into the details of the studies, but know that there are a number of studies that all show improvement in, weight bearing, mobility, pain assessments within these patients with osteoarthritis. There's a newer study that hopefully will be published this year, but was presented at the Veterinary Orthopedic Society conference, looking at dogs with lumbosacral pain. So, lumbosacral disease, degenerative lumbosacral stenosis, is not uncommon in geriatric patients. And even just low back pain as a compensatory issue from hip arthritis or stifle disease or all of these kind of other chronic diseases, dogs can have low back pain. 60% had an improvement in the CVPI, and the CVPI scores declined over time. So the patients actually got better over time. So it was decreased at day 14, at day 28, and then the recheck at day 60. So a pretty good improvement. They also found some improvement in kind of stance and weight distribution. So the dogs became kind of more symmetrical in their weight distribution over time after the shockwave. Other modality options, pulsed electromagnetic field therapy has effects on kind of that inflammatory cascade by affecting nitric oxide. I like the pulsed electromagnetic field therapy as an at-home option for patients. Obviously, coming into the clinic for rehabilitation, coming into the clinic for shockwave does take a lot of owner time and commitment. And in some of these geriatric patients that have significant functional limitations, just the ability of being able to get them in and out of the car can be challenging. So the pulsed electromagnetic field therapy is a nice at-home option that the owners can do on a regular, daily basis to help improve their dog's pain and therefore their mobility. Then other modalities like acupuncture has a whole host of effects. I use acupuncture a lot in my geriatric patients. Laser therapy, while it's very widely used, doesn't actually have a lot of research behind it, especially for like arthritis and pain management in any patient population, but particularly our geriatrics. So I use it, but I actually use the other modalities more often than laser. Manual therapy, things like soft tissue mobilization, massage, range of motion, stretching, all of these things can improve that joint range of motion, how those joints move, and therefore can improve functional mobility. And then other things like transcutaneous electrical nerve stimulation doesn't necessarily improve the functional mobility itself, but can improve pain, which then has an impact on that functional mobility. Other considerations would, especially for our geriatric patients that have mobility issues, evaluating owner flooring, what does their bedding look like? Where is their water and food dishes? How are they elevated? Are they on the floor? What's their nail care like? If they're have really long nails, is that affecting their mobility? And then having the owners use things like ramps and assisted devices like harnesses to be able to help with their mobility. So how do we do kind of planning and reassessment? This is where, having those kind of baseline tools helps to give you kind of a baseline and can evaluate outcome. And so for all of my patients, I really use kind of a multifactorial and multimodal approach to my planning, starting with the things that I know are going to be the most effective and have the biggest impact and have the most research behind them, and then layering other things on. I want to be able to target all of these kind of pieces of physical function. So strength and balance and endurance, general well-being, the ability to perform those activities of daily living. And what makes this complicated is every dog is different. So all of these plans and approaches have to be individualized. And that does take time, and it does take a lot of, especially if you're in a general practice setting and you only have a 20-minute appointment, to be able to, assess the dog's mobility and come up with a plan, that can be really challenging. So, that individualization piece is really important. Obviously, as a rehabilitation specialist, I highly recommend getting somebody involved that is more along the lines of a rehabilitation professional, because that takes the load off of you in general practice. You can, send them to somebody who can do an hour-long appointment and do the full functional mobility assessment and come up with a rehabilitation plan and implement the plan. So doing pain management, we do a lot of ketamine at our practice, therapeutic injections, joint injections, we do a ton of acupuncture modalities, therapeutic exercise sessions. All of these things help with our geriatric patients' functional mobility. And then another important piece that, once again, is a large focus on the human side, and really, I think we all kind of generally understand it, but hasn't really been assessed on the veterinary side how it plays a role in our owner buy-in. But there's kind of this triad of dog, owner, veterinary professional, basically doing patient-centered care is a little bit more complicated because you add in that piece of the owner. And so making sure that you've got good communication and education, collaborative goal setting, making decisions together, making sure that treatment planning is individualized and kind of taking into account the owner's components as well as the dog's kind of pieces when you're coming up with your plan. Typically, if they're coming to our practice for rehabilitation therapy, we're doing reassessments every 4 to 6 weeks and then adjusting the goals accordingly. Obviously making sure these dogs, have baseline and periodic health screening. So doing regular blood work, evaluating for metabolic disease because things like hypothyroidism can affect mobility. Things like Cushing's, renal disease, all of these things that need to be managed in addition to managing their mobility pieces. And then obviously for inside use, weight and body composition monitoring every 4 to 6 weeks, especially if they are obese. If your goal is weight loss, you need to be doing very regular body weight monitoring. And then once again, using these kind of objective and subjective tools like CBPI or Helsinki or load can be used and then repeated on that kind of every 4 to 6 week basis to see, like, is your plan working? And if it's not, how do we need to adjust it? So kind of take home points, trifecta of morbidity and therefore mortality, health span, lifespan, obesity, sarcopenia, and sedentary lifestyle. So all of these pieces you can have an impact on in your practice. So, education about weight management, diet planning, exercise to help with the sedentary lifestyle and that muscle loss. And that nutrition planning also impacts that muscle mass and that muscle loss. And we know that physical function decline has significant impact on aging, health span, and lifespan, and that overall quality of life. So anything that we can do to improve physical function and try to counteract the decline of physical function early, the better for the dog, and then the better for the owner as well. So once again, early recognition and intervention are key. And there's a paper that's going to be coming out in the next couple of weeks about osteoarthritis management, even in the life stage of puppies. And so really trying to maximize early detection of osteoarthritis and early intervention of osteoarthritis as early as the puppy stage. And then it's going to be a series of papers. So there's going to be a puppy stage, an adult stage, and a geriatric stage. But that puppy stage will be coming out in the next week or two, I think, in Frontiers. Top 2 interventions, once again, feel like I'm just repeating this over and over again, but I think it's super important, is exercise and nutrition, and then adding in all of those modalities as needed. And then once again, adjustments in lifestyle and environment.